I am Nestor. I was born HIV positive. I found out when I was 12, 13.
Mi nombre es Ariana Lynn, soy una mujer trans latina que vive en Estados Unidos en el South con VIH desde 2006.
My name's Anthony, I'm 53. I'm positive 21 years.
My brother was HIV positive. When I first found out, time stopped for a minute.
I'm Brenda, I'm 21, I'm from Milford, Pennsylvania. I was born HIV positive. Growing up, being the only one who is HIV positive in my family was very lonely and very confusing.
Our family comes from El Salvador.
Born and raised in Brooklyn.
Nashville, Tennessee.
Chicago, Illinois.
Colombian.
Broward County.
Port Jervis, New York.
Savannah, Georgia.
In Hollywood, Florida.
Anyone can be affected by HIV.
Black, white, gay, straight, it's all over. From the beginning, it was labeled as a deadly weapon disease and everything, where in reality, HIV is just a virus. It's the stigma that's the deadly disease.
There are many myths about HIV transmission, but debunking them can give people a better understanding of what precautions to take and when to see a doctor. Myth 1. A person can contact HIV from touching someone who has it. It's not possible to transmit or contact HIV by touching. Fact. People cannot transmit or contact HIV simply by touching. Myth 2. A person can contact HIV from infected insects and animals. Fact. To transmit HIV, a mosquito or another insect would have to bite a person with HIV, then inject the blood back into another person's body. Insects do not re-inject blood into a new person, so it's impossible for them to transmit HIV. Myth 3. A person can contact HIV from infected water. But the fact is, HIV cannot survive in water, so as a result, a person cannot contact the virus from swimming, drinking, bathing, or other activities involving water. Also, a person cannot contact HIV from the saliva, sweat, or tears of a person with HIV. Myth 4. If a couple has HIV, they do not need to protect themselves. Fact. Different strains of HIV do exist. Therefore, if a person and their partners have two strains of HIV, they can transmit this to each other.
You can only get HIV by coming in contact with the infected body fluid of an HIV patient through blood, semen, vaginal and rectal fluid, and breast milk, through which the HIV is transferred from a mother to her child during childbirth, pregnancy, and breastfeeding. And next, through oral sex. Now, it's very rare to get HIV through oral sex unless you have infected sexual fluid in your mouth and you have bleeding gums or mouth sores, or your partner from whom you are receiving oral sex has bleeding gum or mouth sores. Now, to get infected with HIV, it must get inside your bloodstream through mucous membrane present inside vagina, rectum, or mouth, or through cuts and bruises, or by using infected syringes.
Having HIV doesn't mean end of the world. You can still live a healthy long life with the proper antiretroviral treatment. People who receive the most up-to-date treatments can usually enjoy full social and professional lives as long as they follow the treatment plans. Also, people who receive an early diagnosis and effective treatment can expect to live nearly as long as people who do not have the virus. Antiretroviral therapy is the use of HIV medicines to treat HIV infections. This therapy takes a combination of HIV medicines every day. This therapy is recommended for the people who have HIV and it should be started as soon as possible. This cannot cure HIV, but this therapy can help you live longer with HIV also. This therapy also reduces the risk of HIV transmission, and the main goal of this Antiretroviral therapy is to reduce a person's viral load to an undetectable level.